All right, I think we're ready to get started. Hello, everyone, and welcome to today's event. My name is Keith Weisglass, and I'll be moderating this presentation on grant making in the coronavirus pandemic, what funders can learn from Wuhan. Before we get started, a few logistical details. This presentation is being recorded, and we will share a video link via email with all attendees after the event. We will try to keep the formal presentation under 30 minutes to allow plenty of time for questions if you have them. You can submit questions, as I mentioned earlier, at any time during the presentation by clicking the Q&A button at the bottom of the video screen. Our presenters today are Birger Stamperdahl and Jan Liang. Birger joined Give to Asia in 2006, and he has served as its president and CEO since 2014. In addition to running Give to Asia's global team, he works directly with funders, primarily foundations and corporations, seeking to build strategic charitable partnerships with NGOs across the Asia Pacific. Yan Liang is a senior program manager in Give to Asia's Beijing office. In her role, she works closely with local and national nonprofits across China to oversee program implementation and reporting in our grant making there. During the last 8 weeks, she was instrumental in facilitating our donors' emergency grants into Hubei Province to fund coronavirus response efforts. So she has a lot of insight to share about the work of NGOs on this during this call. And with that, I'll turn it over to Birger to provide some introduction and context to start us off.
Great. Thank you, Keith. Thanks again to everyone for joining this call. We think we have some interesting and relevant information to share for people that are working as funders to address the COVID-19 response in different parts of the world. I would just want to provide a quick overview of Give to Asia and set the stage a bit for the main topic of the webinar, which is what lessons we've learned in China that may be applicable to other communities. And then I'm going to let my colleague in Beijing, Ms. Yan Liang, get into the meat of the discussion. Give to Asia was founded in 2001, and our primary purpose is to help build relationships between international funders and in-country charitable projects in Asia. Today, we are one of the leaders in advised grant making from the United States to Asia, and we typically make about 30 million in grants each year to support quite a wide range of issues ranging from education, health, livelihood, disaster preparedness, and response in the environment. We're based in the United States and have local staff and advisors in the 23 countries where we make grants. And in China, we are registered under the Overseas NGO law that was put in place in 2017. And currently we make about 80 grants a year to mainland China for charitable projects across the entire country. And we have a full-time staff of 8 people in Beijing. For the disaster response work that Give to Asia does, while disaster response is only one part of the work that Give to Asia does, we have a great deal of experience working in the context of local response efforts and have been doing this since 2004. We see our role primarily as partnering with in-country organizations that are taking action locally. And that has been our primary focus with our funding. Probably about 40% of our disaster funding has gone, per event to short-term relief needs, and we try to also put a good deal toward mid to long-term recovery, which sometimes is the piece that gets overlooked in a disaster. Our funding generally comes from various private sources, including corporations who are either seeking to have more of a local impact with their disaster funding, or who are also engaging their employees, as well as working with families, individuals, and private foundations. For the COVID-19 response campaign, we launched our campaign on January 23rd, when it became clear that Wuhan was facing a significant crisis. Within 2 days, we had received confirmation from our professional supervisory unit in China, CPA FFC, which oversees all of our work there, as well as from the Beijing Public Security Bureau. We received feedback from them that they would provide 48-hour approval on relief projects for the COVID-19 outbreak, which is quite quick approval in China under the current laws there. During the campaign, we received significant funding from both corporations and individuals, totaling about $8 million in commitments. And we heard about various needs from our local partners in China who had direct access into Hubei Province. The two primary needs we focused on included supporting frontline health workers and also increasing the capacity of patient care in locations where medical service capacity was stretched beyond limits due to the virus. And just in the past week, we've launched an expanded COVID-19 campaign to work in other countries and support their in-country efforts in places like South Korea, the Philippines, and India. So just a little bit on our outputs, I guess, from the COVID-19 response in China. Approximately a quarter of our funding so far has gone to deliver protective gear to frontline health workers or to the elderly. Approximately a quarter has gone to hospital and community disinfectant, primarily around Wuhan. Approximately a quarter has gone to medical equipment such as ventilators and blood analysis machines. And finally, the last quarter has gone to meals and supplies for frontline health workers and in some cases also for patients. This photo is actually from the seafood market in Wuhan, where some of the earliest cases were detected and where it was initially thought that the outbreak started. It was since determined that this fish market was not the site of the first infection, but I wanted to share why this photo was here and why it was so relevant to this discussion. The purpose of this webinar, as I mentioned before, is to share what lessons we learned in Wuhan that might inform response efforts and philanthropic activities for COVID-19 programs outside of China, including the US. While there are, of course, differences in the context and response, we believe there's a lot of similarity. Soon after we launched our campaign in late January, we found that our staff in China was confined to where they were located during the Chinese New Year holiday, and mostly that was in Beijing or in Guangzhou. But during the past 2.5 months, our team in China has been working diligently and remotely from their homes, dealing with both the personal challenges of being limited in their travel and availability of supplies in some cases, and also the challenge of simply watching a crisis unfold in their country and within their communities. Currently, where I live in the San Francisco Bay Area, the entire Give to Asia headquarters staff is living under a shelter-in-place order by local counties here. So what we observed happening in China a couple of months ago has now come home to us. And I think we appreciate in a very different and real way the challenges that our colleagues in China have been facing for a long time now. And we do think that the similarities in the needs make China sort of maybe a forerunner in the response effort that's needed elsewhere. And so I want to pass the presentation now over to Ms. Yan Liang, who is based in Beijing and is calling from Beijing, to share more about that experience and relate to some of the details of Give to Asia's work.
Okay, thank you, Birger. Thank you everyone for joining this call. I hope what we're sharing would be helpful for you in considering this, how to respond to the crisis. So we begin with the immediate needs identified on the ground. The first two, I would call them immediate and obvious ones, including personal protective equipment of healthcare workers and diagnostic, monitoring, or treatment equipment. Then there comes the less obvious but equally immediate needs, including meals, lodging, care for family members of frontline responders, as well as patients under quarantine. And how about the surge in health system capacity? It is needed to divert non-COVID-19 cases, reduce overcrowding at hospitals and clinics, and prevent avoidable infections. But for people not infected with COVID-19, they need to know where they can go for their routine treatment. And then comes the care for vulnerable groups. This is really immediate, but there are differences depending on communities. So there are elderly people, health compromised people, unhoused. And then in every disaster, pregnant women is always a unique category. What if they cannot go to the same clinics, see the same doctor? And then what if their routine checkups cannot be made, et cetera, and et cetera. And then the anxiety they're dealing with. And then also the new moms, they felt isolated and then they worried about their newborn babies. And then there were cases where newborns were infected, unfortunately. And then people who cannot afford meals due to lack of income. And then students. At this time, I think many of the schools in the US are closed too. The campus are closed, and then students are required to take online classes. What if the students do not have the required equipment? What if they cannot afford the data package to learn online? So these are the very real challenges they're facing, the local grant people. And then comes to our NGO partners. So with all those needs, how our local partners are doing in terms of how they responded to the needs identified. About the supply shortages, it's just really shortages everywhere. And then many of our NGO partners, they find themselves lack this expertise. They don't have the healthcare industry knowledge for them to choose the right products, matching the medical needs. So some of them delivered masks to the hospital only to find that, you know, the health workers cannot wear them. Those are for community workers probably. And then also for products sourced from outside of China, they're complicated process for import and delivery on the ground. Adding on to that difficulty, there are restrictions on staff's mobility. As many of you know, there are strict lockdowns in Wuhan city. So the airport, highways, railway station, and public transits are all closed. Permits are required for transport on the ground. Residents are not allowed to live without permission. Elsewhere in China, there are all kinds of limitations and restrictions for each household. So the NGO staffs, they are not free to move around and to work, similar for us though. And then inevitably, their user service delivery interrupted due to the traffic restrictions and also due to the social distancing requirement. And then at this time, there are many organizations suddenly realize that they are not fully prepared to take their work online remotely. And then internal communications and collaborations could be challenging at a time like this too. So they are in a way crippled when a time that they need to deal with more complicated issues. So, next page. And then there are some very impactful cases we identified and then we want to share here. So we saw this cross-NGO resource coordination. We find it really interesting and efficient. The first one is the CNC COVID-19. It's short for China NGO Consortium for COVID-19. It was a network started by 10 major NGO players in the very beginning. And subsequently, there are about another 10 joined. So the goal of this consortium is to provide daily updates on the responsive efforts they are doing or they've seen other NGO players are doing, and then to support frontline responders, including to providing synchronized information to provide a platform so that different players can better coordinate among themselves. Also, they do advocacy work during this time. They invite experts for guidance and advice, and then to publish articles responding to some hot topic issues in the public domain. So people can help on the front work and then also think about the deep down issues and then have a candid discussion about what the next steps are likely to be taken. Another interesting and impactful showcase is Wuhan Ginkgo in Action. So a bit background about Ginkgo Foundation itself. It is a private foundation. Its mission is to connect and inspire young action makers with social entrepreneurship. So suffice to say, over the years, they are making investments in people. And then in a time of crisis of this scale, these Ginkgo fellows, they naturally gather together to brainstorm and then to talk about, to share how they can respond collectively and efficiently. So they named it Wuhan Ginkgo in Action. They have people based in Wuhan, and then they have people with various expertise required at this time. And then I think the fundamental, the underlying trust is the key. And then this was built over the years they worked together. It has made it much easier for them to collaborate and respond more efficiently. So for the information sharing, there's another case, grassroots communication system. It was put together by Zhuoming Disaster Information Service Center. Interestingly, the person in charge of Zhuoming himself is a Ginkgo fellow. And what they did during the crisis was they created a yellow book sort of document with open access to all. So you can see a screenshot on your left. Unfortunately, it's mostly in Chinese. So all the work is done by volunteers because it's open access, but it has basically all the information you can think of. For example, if you wanted to report a need, you can find the relevant channel to do so. And if you have time or energy or resources that you wanted to help out, you can search for the open needs and then match that. And then you can, if you have a question, any question, you can probably find some sort of answer. And then they have like chat room for patients who can discussing their feelings and symptoms. And then they have also channels so that NGOs can share the sources where they found the supplies or the experiences they're dealing with the people on the ground. And then they also have pro bono channel where people can seek legal aids. So when everything's moved online, this document is shared online. So people find it very efficient. And then they have something like including all they can access anytime they want. They found it really helpful. And then another type of collaboration is between NGO partners and corporate. There are a few cases, but the one I listed here is the Jack Ma Foundation and Alibaba Foundation. They recently launched this GMCC program. And then there are a few others we've seen on the ground as well. The pattern here is for the corporate partners to basically enabling their NGO partners by opening up corporate resources or platforms. So we've seen corporate sharing their logistics systems or capacity with NGO partners. And then we've also seen their corporate partners who have expertise in the healthcare industry, so they can help screening supplies, whether these are medical grade, suitable for hospital use, whether the prices are fair, whether suppliers are genuine, et cetera, et cetera. So taking that piece of their NGO partners' mind, so it's really helpful. Okay, we can, next slide, please, Keith. Okay, so here we are talking about long-term recovery needs because this is where we are focusing our efforts. Actually, we thought about from the very beginning, we were discussing the sort of the long-term, mid-term recovery needs with our partners back then. So this is only the time that we started to planning. First of all, there's like physical and mental health care. And then there are continued care for frontline responders, their families, especially for those who fell ill in line of duty. And then also, how can we support economic recovery? We all know it's going to be daunting, but how are we going to respond to that? And then also, we're checking in with our NGO partners. Some of them have concerns about their own funding gaps. So how to end this nonprofit starvation cycle is a challenging issue out there as well. And finally, there's this preparing for future outbreaks. So there are people doing health worker training, capacity building, or raising awareness at community level. All that would be helpful in the long run. So we are currently discussing with our partners how to best use our resources to design programs towards that goal.
Great, thank you, Yanliang. So I think that that's a good place to pause and invite everyone in the audience to ask questions. We've tried to give you a sort of a summary overview of some of the lessons learned from Wuhan, but there's, I think, plenty more to share. So there's a Q&A button at the bottom of the webinar if you want to ask a question of either of our presenters. You can go ahead and submit it there. And as those come in, I will ask them. Okay, so our first question is regarding what charities we worked with in China. Birger or Yanliang, can you provide a bit more context on who are the folks we were working with, maybe particularly at the local level?
Sure, I can start, and then Yanliang, you can fill in the gaps for me. I think we were initially working with just maybe a couple of organizations in the early days that were that are both national organizations but also have chapters either at the province level in Hubei or in Wuhan, and so those were groups like the China Red Cross Foundation and also the China Charity Federation, and then we began also exploring ways to work with other organizations that maybe are not specifically relief or emergency response organizations, but that were mobilizing because of the scale of the need in Wuhan. And one of the partners that ended up being, quite important to us, I think, in a lot of our funding was also the China Women's Development Foundation, which also has a sort of a local chapter system and had good access into Wuhan during the height of the outbreak. And also was able to deliver equipment directly to specific hospitals. So that's a quick snapshot of the kinds of organizations that we were funding in China. I think there is for many of the larger national level organizations a chapter system that allows them to go really local into specific communities, and that certainly, I think, helped with being able to get into Wuhan and Hubei Province with our funding.
So we have a really interesting question here that just came in, which is philanthropy in COVID-19 just filling gaps in government services and responses, or are there situations where philanthropy has a strategic advantage compared to government?
And I might let Yan Liang answer some of this in the context of China. Certainly, there was, I think, a very early response need with groups like the China Red Cross Foundation and China Charity Federation to meet equipment needs. I think one of the things that we were, and also protective gear needs, and I think one of the things we were able to do was to make some connections between perhaps some of the suppliers and our nonprofit partners in a way that leverage just some of our unique network. And I think that certainly helped support some basic needs in hospitals, such as the ventilators and blood analysis machines that we talked about earlier. But as some of the immediate response was also being taken over by some of the Chinese government response, I think that's when we also started to see some of the other needs that might have been more of filling in the gaps where there were communities at risk, or sort of maybe families of people who either were working as frontline health workers or families of patients that needed support. Yan Liang, do you have anything else to add to that, or did that cover it?
Yeah, I think that pretty much covered it. I think, as Birger, you just summed up, I think for hospital needs, it's maybe for equipment, it's looking like more about filling the gaps that the government cannot fully cover. But for those family needs, personal needs, community needs, I think this is really the traditional role that the NGOs are playing, but they are just function in a different way or covering a different group of people.
Mm-hmm. Another question is, someone says they have operations in about 30 countries. Do we have suggestions for how to address those needs globally? Like, is there do we have a suggestion for a global fund that might allow supporting like many locations geographically?
Well, Give to Asia's focus has been, well, clearly we're focused on Asia, and we are now focused on multiple countries with an effort to partner within country organizations that are supporting frontline health workers and other needs for immediate services to patients and healthcare facilities. I think that the global question, that we know that, for example, our partner in Europe, the King Babwon Foundation, is currently putting together a fund with some larger institutional funders in Europe that's also going to be part of a global response. So they tend to cover Europe and Africa. But I think one of their partners is actually the World Health Organization. So they might have a bit more detail on specific global efforts. But between KBF and Give to Asia, I think we cover at least 3 continents. And I think that there are many other efforts happening with INGOs, with global footprints that are seeking to either affect an improved response effort, or working on things like vaccine development and those kinds of things.
So we have a question from someone who says they're in in country, one of these, probably a country that is looking, which I guess is everywhere, looking to respond to COVID-19. And their question is how they can take some of the best practices and work that was pioneered in China, for example, for testing and for, supplies, and take advantage of that in their country. Yeah, Liang, I'm wondering if you can speak to some of the things that that NGOs learn from working with suppliers in particular, or best practices that might be useful for other countries to try and implement based on China's example.
The thing I can immediately think of, it's really interesting, is the Wuhan Ginkgo in Action, the team. I was talking with the team leader this afternoon, and then she said, because in China, we are at the sort of the second phase now, so they are actually putting down in writing something about their experiences, the resource they identified, et cetera, very useful information. They're happy to make it public and share with all. So that's something I think we can, Keith, you and I can somehow put the link or resources open to our audiences here today. I'm sure there will be very useful information in that sharing. So that's something immediately come to my mind. And then in terms of direct experience in China, I think we would encouraging our local partners to think out of the box, because many of our local partners we worked with think differently when facing a crisis of this scale. So many of them find creative solutions, like, for example, we mentioned they partner with the corporate teams, and then maybe their employees, maybe their volunteers can link some of them together and then make a difference. Something like that. I think it's really, the responsive efforts really depending on the local environment they will be in, how to find the best solution. Yeah.
This is Birger, and I'm just thinking about some of the differences and commonalities in the China outbreak versus the US outbreak. I think one of the big differences is that in China, the outbreak was very much focused on in one place in Hubei Province, although certainly there was a response across the entire country. In the United States, the outbreak is much more spread out. There isn't one central point. Right now, I think Washington State, California, and New York are the three biggest, hardest hit states. But one of the things that I think was very helpful for us in China was the ability to work with the local chapters of some of the national organizations. And in the US, what I hear a lot of people talking about is engagement with community foundations and some of the local health resources that exist state to state. And so I think the ability for us to do some of the funding that we did in China really depended on our ability to get into the community. And that might be a different mechanism in the United States and in other countries, but I think that's, that was important for us to gather information on what was needed, and then figuring out what are the networks at the local level, at the either maybe in the US at the state level or even at the county level that have the information on what's needed, and how do those networks talk to each other so that it's so there might be one repository of needs.
Mm-hmm. We also actually had a question about the differences since we focused on some of the similarities, the differences between the response effort, specifically the philanthropic response effort that was needed in China versus what's going to be needed in other countries. I'm wondering maybe if you can give some perspective on what we think will be different, maybe say between China and the US experience for funders that also grant make locally here, and China versus other countries in Asia.
Well, going back to the question about where philanthropy plays a role, and does it primarily play a role in filling in the gaps? I think that gaps are different depending on the country. I think that, and also depending on the response. I think similar to what Yan Liang talked about in China. There's also going to be, I think, big issues around education and online learning, and just how families and communities deal with closure of schools nationally, perhaps through the rest of the school year. And those are gaps that can be filled in some countries with support from local nonprofits, and in some countries, those are gaps that might already be covered by government. So I think it's partly based on a country by country look at where the gaps are, and where, when we're talking about private funding and philanthropy, where there's an opportunity to fill those gaps where government isn't equipped or focused on stepping in. And I do think that's different country by country.
Yan Liang, anything you'd want to add about differences you anticipate from say the experience of either funders or nonprofits would have in China versus elsewhere in Asia Pacific? I think you're on mute if you're
yeah, sorry, I was
responding.
mute. Yeah, I'm trying to think, how would that be different? I think I think about, you know, the responsive measures that our government put into is quite strict, right? So I wonder if it's different level, whether our NGO partners would be more active or acted differently in a way. So in terms of philanthropy, like funder perspective, I think there's more commonalities in these two scenarios, indeed.
Mm-hmm. Okay, wait, two new interesting questions came in. The first is, do we know of any grant making or NGO responses focused on addressing mental health needs while people are being told to socially isolate? So perhaps general population as opposed to healthcare workers.
I think I've seen a few. I don't have the names right now, but from the earlier days, I think I've seen posts online that there's some therapists being offered to people, like online consultation sessions. And then nowadays, I saw some organizations, they designed and more fulsome program dedicated to help different groups of people, like healthcare people or patients or people who lost their family members, or just people suffering from anxiety due to this isolation. So yes, the answer is yes.
Mm-hmm. And we'll try and compile some of these, if we have resources or examples that we can share, we'll include those when we share the recording of the webinar.
Yep.
The other question was, what flexibility, did we see any flexibility by existing donors of existing contracts or grants? So for example, to enable nonprofits to re-enable the program, or to reprogram, or to reallocate resources. So if a nonprofit had a restricted grant, do we see any examples of funders giving NGOs flexibility to support the COVID response?
Yes. Actually, we have a long-time donor who always supported local NGOs in disaster preparedness. But back then, the focus is always on natural disasters because, you know, in China, earthquake, flood is, you know, spring country. So this is a repeating program, but the new cycle, I think, begins from end of last year. So the local NGO partners has been doing some preparatory work, but hasn't been really actively implementing the project before the COVID-19 crisis came up. So our donor decided almost immediately to reallocate the use of the funds. So that has been diverted to address the COVID-19 issue. So that's the one instance I know of. And in terms of support for other, we've also seen support of local NGOs addressing their overhead issues, because we have this local partner who designed this map to track confirmed cases. They have a map used to be tracking environmental issues. So they, while they were all isolated at their home, the staff expanded their services to cover reported cases, confirmed cases, because they can cover more detailed community areas. And then we have one donor decided to support that effort, even though this is not in their environmental area they used to be supporting. So that's the flexible we've seen too.
Mm-hmm. I think that's a really important point. There may be infrastructure that can be reallocated. Yeah.
And that this is Berger. I just want to add, this isn't directly related to COVID-19 funding, but it is a change that we're seeing from some funders in what they had lined up for 2020 and being flexible and sort of and having to change really some of the scoping of projects. So an obvious one is we have funders who are funding projects that require in-person gatherings. And so we've had some funders come back to us and say, well, that probably isn't going to work this year. So how can we rescope this project, either to make it a virtual gathering or put it towards something else that's maybe more critical for the local organization in the current context of the COVID-19 outbreak.
Mm-hmm. We received another question, which is, has the response to COVID benefited in any way from the experience of responding to SARS, to the initial SARS outbreak? If so, how has, like, what were some of the lessons learned there?
I'm not sure that we have a real clear answer on that, on how maybe the SARS epidemic informed funding now. I think that certainly some of the response effort and the methodology used by some of the relief organizations was and recommendations from the CDC on how to respond were informed by experiences from SARS and MERS. But I don't at hand have a really clear example of specific program implementation that was directly changed because of the SARS experience.
Okay, another question is, are we still raising funds in China, or is that sort of past the, is the focus now exclusively on other countries?
Yes, we are. As I mentioned earlier, so typically we try to direct about 40% of our funding to immediate relief, and typically in a disaster response, we try to direct about 60% to longer term recovery. It's a little bit different in this case because it's not a single event that happens on a day with a large sort of large response that happens over a few weeks following that event. This is an event that it's still ongoing and has been going on for months. So it's a different kind of crisis. But we do see significant need for recovery funding in China along some of the lines that Yanliang mentioned around helping helping people get back on their feet economically. I think we have some interesting projects that we're putting together right now with some partners around supporting livelihood for communities that were very harshly economically impacted by the COVID-19 epidemic in China and Hubei Province. We also have some ongoing programs for longer term support to frontline health workers who will continue to be in the area for the next 6 to 8 weeks, supporting the response, even though the cases have dropped off. There's still need in sort of the epicenter area for those health workers to stay in place, and also some work supporting the families of health workers longer term. So there's definitely a lot of funding that we're still hoping to bring in for those long-term needs.
Okay, another question is, what are some of the, maybe some of the lessons learned, and this one I'll direct toward Yan Liang, for advice that funders can give to their grantees, or even for the funders organizations themselves, about how to continue operating sort of at peak, or even above normal capacity, while dealing with some of the logistical challenges and restrictions that the quarantines create.
Well, the very first question I think I would ask or check into is that do they have the infrastructure set up to, as I mentioned, to work remotely for all the people not being able to meet in person, but still being able to collaborate together to get things going. I think that is to make sure that the team can still function. And on top of that, I think it's to figure out the strength of the group, or depending on the types of the nature of the NGOs, the group of people they usually pay attention to, are they particularly vulnerable under these circumstances, and then how they're going to respond to the group that they've been taking care of all the time. I think that's the immediate question. Maybe people can start planning. And then I think the next question is, how can you cover other groups, or make a bigger wave of your efforts? Yeah.
Thanks. So we actually have a new question here, which is some suggest that COVID-19 will come in waves if the travel restrictions are lifted. So the question is, do we agree with this, and how can if so, how can philanthropists from different countries coordinate or on this? Basically the lifting of the travel restrictions. Has there been any examples of collaboration across countries in the philanthropic sector around this idea of lifting the restrictions, and how that affects the spread of the epidemic?
So neither Yan Liang or I are virologists. So as far as how the virus will behave, I think a lot of the information that we have is information that's been shared with us secondhand. So whether that happens or not, I think that there is. We do see some organizations at the global level thinking about the this part of handling the travel restrictions. I think the big funder in that space is the Gates Foundation, that's doing some work thinking about both vaccine development, but also sort of some of these larger international issues around preventing the spread of the disease across borders. I think that one of the things that I'll just comment personally on is that in the United States, I've talked personally and professionally with people about the current shelter in place order, and also some of the travel restrictions we're seeing internationally, and some people hoping that those things get lifted sooner than later, partly due maybe for economic reasons. But I think it seems like those kinds of orders or restrictions might end up being in place for a longer time, even after numbers go down, to help prevent something like a second wave of infection. What I understand from China is right now that all of the new infections are from people traveling into the country, having visited elsewhere, and who are getting stopped and quarantined as they're coming in. So they'll probably, there'll probably be an extended period of time where people are being quarantined as they're traveling in order to prevent that, I would imagine.
Thanks. I think this is probably a good place to wrap up the discussion. And if anyone has any further questions, we're of course happy to answer them over email or to hop on a call. Our contact info is here. We will be sharing a recording of this presentation. If you want to share it with colleagues or just reference the slides, we'll send that around within a day or two. And so I guess before we wrap up, I'll ask Yanliang and Birger, is there any parting thoughts or things that you know that you'd want to share with folks here based on our the 2-month lead time that China has had to learn how to deal with this this crisis?
The first thing I wanted to say is just take it seriously. I think in the very beginning, people even here, there were people not taking it seriously enough, obviously. And then I hope things were, were taken seriously from the very beginning. And then for our NGO partners, again, as I said, I think people should think creatively in a situation like this. It's not in their normal role, but probably think how they can respond, and then who can they link together, and then what would be the most critical need they can address during this challenging time. I think that would be very helpful. Yep. Thank you, Keith.
And I guess I would say, just as a thought, is that this is going to be probably just as much of an economic crisis as it is a health crisis. And so I think thinking about who are the most affected populations in the countries that you're looking at. I think in China, I think we've seen, perhaps migrant workers are at some of the more at-risk communities, and Yanliang also mentioned pregnant mothers and the elderly. I think when there's an economic downturn, disadvantaged people suffer first, and there's going to be a lot of needs around not just disaster response, but psychosocial needs, as we mentioned, and also education, which is shifting globally right now due to the outbreak. So keeping the broader picture in mind of both the current crisis in terms of the outbreak, but also thinking about the deeper, broader economic impact and the people who are most going to need help.
Great, thank you, Birger. Well, for anyone who'd like to learn more about grant making in the Asia Pacific, you can go to givetoasia.org. And of course, we're also happy to answer any questions that are helpful to grant making work, even outside the countries we work. So please reach out to us anytime if our staff can be of service. So thank you to both our presenters and to everyone who attended. I know it's a very, very busy time as everyone reconfigures to working remote. So we appreciate you spending this hour with us, and we'll look forward to speaking with you again soon. Thanks.